You've been lied to. You've been lied to about how to keep healthy, specifically how to keep your skeleton healthy. I'm Kansas City, not Kansas City, and I want to tell you about how your diet affects your skeleton. Now, all nutrients, indirectly or directly, somehow, shape, way, or form, factor into our skeletal health, just like any other system in our body. Our skeletal health depends on all nutrients. I'm just going to talk about the nutrients that I suspect you've been misinformed about or underinformed about. And I'm going to split this presentation up into a couple of parts. The first part will be exclusively on calcium. You go around asking people what nutrient they should consume more of to improve the health of their skeleton. The answer you're going to hear most is calcium. And why not? That's what we're told all our lives. Bones are mainly made of calcium, and we have trouble holding on to calcium, especially when we get older. We should just load up with calcium. When we get older, we lose calcium. So that's when we need to consume even more calcium to try to partially compensate for that loss of calcium. And we're told that children and adolescents should also consume even more calcium for the exact opposite reason. That's when our bones are very proficient at packing on to calcium, so let's pack it on while we can. We know we're going to lose it when we get older, so let's overinflate our bones with calcium while we can and hope that by the time they diminish down to osteoporotic levels, hopefully by then we'll be dead. It's a strange strategy to take, but that's a strategy we take. That's a strategy we're told to take. It's like if you have a bicycle with a leaky tire. Just overinflate your tire at the beginning of your trip and hope you reach your destination before the tire is flat. Now, it hasn't always been that way. In the 1940s, studies showed that low intakes of calcium really didn't affect bone health at all. And in 1962, a joint committee of the World Health Organization and the Food Agriculture Organization concluded that most apparently healthy people throughout the world develop and live satisfactorily on a dietary intake of calcium which lies between 300 milligrams and over 1,000 milligrams. And in 1974, that committee officially recommended 400 to 500 milligrams of calcium a day. Then things changed in the late 70s. That's when we started seeing these calcium balance studies. And by calcium balance, what they do is they add up all the calcium that people put into their body, subtract away all the calcium that leaves their body, and the difference is the calcium balance. So if that number is positive, that means that the calcium content in their body is increasing. And presumably all that extra calcium goes into the bones, making the bones stronger. If that number is negative, then the bones are losing calcium. And a couple of the more famous of these studies, some of the original of these studies, were done by these researchers. And they found that by increasing the amount of calcium people consume, that's going to give them a higher calcium balance. So they said, okay, let's just consume more calcium and get a higher calcium balance. And let's try to at least reach that critical level of calcium where we could call that the break-even point. If you consume more than that amount, you'll be increasing the amount of calcium. Less than that amount, you'll be losing calcium. And this is the amount that is just a zero balance. The calcium balance comes out to zero. And they found that that critical amount of calcium to consume to reach that break-even point in premenopausal women is 990 milligrams per day. In postmenopausal women, it was 1,500 milligrams of calcium a day. So even postmenopause, I think I might have said pre instead of post, but postmenopausal women, the critical value is 1,500. So even postmenopausal women can still continue to increase the amount of calcium in their bones, increase their bone strength by consuming more than 1,500 milligrams of calcium per day. So, of course, the recommendations started going up. In 1997, USA and Canada increased their recommendation to 1,200 milligrams per day in adults over 50 years old. And that same joint committee of the WHO and FAO that had recommended 400 to 500 milligrams in 1972, well, in 2002, they increased it to 1,300 milligrams for postmenopausal women and for men over 60 years old. And just recently, a couple of years ago, the FDA increased the daily value here to 1,300 milligrams. The daily value is what's used for the nutrition facts panels on our food labels. So that's been just raised up to 1,300 milligrams a couple of years ago. All spurred on by those calcium balance studies. But there's an issue with those calcium balance studies. A few issues, actually. For one thing, they weren't very accurate. And more up-to-date calcium balance studies came out with different numbers, actually. This study published in 2007, they found that zero balance was at 741 milligrams per day. And that's in all adults. Gender didn't matter, age didn't matter. 741 milligrams. And they also said that if the consumer consumed more than that or less than that, it really didn't affect the calcium balance a whole lot. But that's really a moot point because of a much more important flaw to the calcium balance studies. And that's that to do anything with the results, you have to make a big assumption. You have to assume that all that extra calcium of a positive calcium balance is going to go into the bone. And that's just not true. A lot of it goes into our soft tissue, hardening our joints and the disc between our vertebrae. And a lot of it just kind of accumulates on the walls of our blood vessels, building up plaque. Then in the 80s, more technologies became more readily available, such as photon absorptiometry. And with these technologies, the researchers were able to actually look at our bone, the actual bone, instead of just looking at the calcium going in and the calcium coming out and making assumptions of what happens in between. They were able to look at the actual bone. And studies done with this technology had results that had very different implications than the calcium balance studies. For one, this British Medical Journal, 1988, this study was published in there. It was done on postmenopausal women, and they looked at the effect of calcium intake on their trabecular bone mineral density. And they found that it has no effect. The level of calcium they consume had no effect at all on their trabecular bone mineral density. And that word trabecular, that's actually very important, and I'm going to explain what that is in a couple of more slides. So these researchers, they say suggestions that a high intake is either effective in preventing postmenopausal osteoporosis or an important adjunct to hormonal replacement treatment seem to be without foundation. And that was in 1988. Oh yeah, and they also cite an example to really illustrate how misleading those calcium balance studies could be. And so they cite an example that was published in 1985 where postmenopausal women were given calcium in the form of milk supplements. And those milk supplements increased the women's calcium balance, yet no effect at all on bone loss. So they said, this emphasizes the limitations of calcium balance studies and the necessity for direct skeletal measurements. Fast forward 3 decades, and scientists are still agreeing with them. 2015, Journal of Internal Medicine. Introduction of bone densitometry in the 80s finds there is little evidence of a relationship between bone density and calcium intake. Okay, so maybe there's a relationship between calcium balance and calcium intake, but bone density, not so much. And they also cite an example to show how misleading those calcium balance studies could be, where the subjects were consuming 1,500 milligrams per day of calcium, and the calcium balance was positive, as in, meaning that they're accumulating more calcium, so that means that their bones should be also accumulating more calcium. Yet, the bone mineral density was actually decreasing. So we really have to look at the bone mineral density, not the calcium balance studies. And not just any bone mineral density, we should specifically be looking at that trabecular bone. The trabecular bone is the internal portion of the bone. It's a kind of a spongy matrix, and it's wrapped in a hard, dense surface that's called the cortical bone. Now the cortical bone, being so hard and dense, it actually makes up about 80% of the total weight of the skeleton. The trabecular bone, even though it's only 20% of the skeleton by weight, it's That's where most bone turnover occurs. And osteoporosis is actually predominantly due to demineralization of the trabecular bone. Okay, not so much the cortical bone. So we really have to look at the trabecular bone. And remember, if we're looking at overall bone mineral density, we're mostly looking at cortical bone because the cortical bone makes up 80% of our skeleton. So it's really important to focus on that trabecular bone. Either the trabecular bone density, or they could take what they call a trabecular score. And the trabecular score is done by, they take kind of a three-dimensional image of a trabecular bone, and they take a ratio of the tissue, which is called the trabeculi, take a ratio of the trabeculi to the open space between the trabeculi. And from there, they come up with a number that's called the trabecular score. So you can see how a healthy bone will have a much higher trabecular score than unhealthy bone. And just to show how important it is to look at trabecular bone rather than overall bone mineral density, here's a study published in 2017 where they looked at the effect of diabetes on bone health. And they found that type 2 diabetes, surprisingly, was associated with a higher bone mineral density, overall bone mineral density. Like, is diabetes actually good for our bones? But the fracture rates for people with diabetes was higher than the controls. So, it doesn't seem like actually diabetes would be healthier for our bones. And lo and behold, if you look at our trabecular scores, the diabetes was associated with a lower trabecular score. So we really have to look at the trabecular bone. And we find that if we're looking at trabecular bone density, instead of looking at those calcium balance studies, we get a very different story. All these studies are coming out now with the bone density. 1987, this study was done on 106 normal women. About 2/3 of them were postmenopausal. And the conclusion that these researchers came up with is these data do not support the hypothesis that insufficient dietary calcium is a major cause of bone loss in women. 2015. The current recommendations for intakes of 1,000 to 1,200 milligrams per day, and remember this is 2015, so it's before the U.S. FDA increased the daily value from 1,000 to 1,300. So here they're talking the current recommendations for intakes of 1,000 to 1,200 milligrams per day are not firmly based on evidence. Intakes in women consuming only half these quantities are satisfactory. And they go on to recommend 500 to 1,000 milligrams per day in older individuals with osteoporosis. Here's a study from Pediatrics 2005. They reviewed 58 different studies, any study they could find that associated calcium to bone health or specifically milk to bone health. And they found neither increased consumption of dairy products specifically nor total dietary calcium consumption has shown even a modestly consistent benefit for child or young adult bone health. Yet we're still recommending such high values of calcium. Here's a study specifically on men. 2017 it was published. And they looked at 323 men in this study. And their conclusion, bone mineral density and rates of bone loss were unrelated to calcium intake in these men. This suggests that strategies to increase calcium intake are unlikely to impact on the prevalence of and morbidity from male osteoporosis. And of course, the group of people that are most at risk for osteoporosis, postmenopausal women, controlled studies showed no significant effect of calcium intake on mineral density of trabecular bone, and a slight effect on cortical bone. But since primary postmenopausal osteoporosis is predominantly due to demineralization of trabecular bone, there is no justification for calcium megadosing in postmenopausal women. Yet that's a pretty common practice for doctors to prescribe megadoses of calcium to their patients who are osteoporotic or osteopenic, specifically usually postmenopausal women. It's still going on, even though the studies are showing it's not helping. In fact, there are actually adverse effects to too much calcium. We already alluded to the fact that extra calcium could build up on the walls of our blood vessels, causing atherosclerosis. Also prostate cancer, specifically if the magnesium intake is not also very high. And we'll talk about that a little bit later today, and also in part 2 of this presentation, how important that calcium to magnesium ratio is. You don't want that ratio to be too high. If you're consuming more calcium, you better be consuming more magnesium too. Calcium inhibits the utilization and sometimes the absorption of a lot of other minerals. And so that's going to affect our health, obviously. And here, ironically, too much calcium could cause osteoporosis. And there are a few reasons that could happen. For one, just like the point before, it says that calcium inhibits the utilization of other minerals. And remember what I said at the very beginning of this presentation, that our bone health really depends on all vitamins and minerals and nutrients. And if calcium is interfering with that, it could be interfering with our bone health. And most importantly of those is magnesium. Because magnesium actually makes up a good part of our bone too. And also, magnesium indirectly affects our bone health too, mainly by getting the calcium into our bone. So all this extra calcium that we're consuming, the magnesium could help get it into our bone instead of into our soft tissue, instead of building up plaque on our arteries. So a deficiency in magnesium could cause osteoporosis. And too much calcium, for all practical purposes, is the same thing as having a deficiency in magnesium. And this one's a theory. Some scientists suggest, and I'm really emphasizing the fact that it's still a theory, so I don't get a bunch of backlash for this, but a lot of scientists suggest that too much calcium, especially when we're younger, burns out our osteoblasts. Our osteoblasts are the sites on our bone that kind of pull calcium out of our blood and pack it onto our bone. And they die during that process. It's called apoptosis. And so the theory here is that too much calcium when we're younger, especially when we're younger, is kind of like sprinting at the beginning of a marathon. It's not pacing ourselves. It's getting a bunch of calcium on our bone. It looks great, but then our osteoblasts die out. So now the osteoblasts do get replenished. We have mesenchymal stem cells that can morph into osteoblasts. But perhaps that whole mechanism of the mesenchymal stem cells morphing into osteoblasts, maybe that mechanism gets burnt out too. That's the theory. Now, if we want to talk about supplements rather than just too much calcium in our foods, we have a whole additional list of adverse effects. For one thing, gastrointestinal issues. And this includes visits to the hospital, okay? I'm not just talking about farting in embarrassing situations. Also kidney stones, heart attacks, and strokes. So are doctors telling their patients about these risks when they prescribe megadoses of calcium to their patients? Are they telling them of these risks? They really should be. In fact, there's probably no point in them to be prescribing them megadoses of calcium anyway, because it's not really helping apparently, and there's actually adverse effects. Nutrients 2013 published reports that high calcium intakes in free-living adults have relatively little or no beneficial impact on bone mineral density and fracture rates, suggest that current recommendations of calcium for adults may be set too high. They go on to say the likelihood of soft tissue calcification may increase in older adults who take calcium supplements. In eliminating potential risks of cardiovascular disease from excessive calcium intakes needs to be factored into policy recommendations for calcium by adults. Are they? Are they? They really should be. Here's a study published in 2014 done in Taiwan, where they looked at, again they were looking at, researchers were looking at diabetes, men with diabetes, and how calcium affects their bone health and other parts of their health. And they discuss all the adverse effects of too much calcium, and they end up recommending 402 to 600 milligrams of calcium per day. So by the way, 600 milligrams is the RDA of calcium in Taiwan. You know, that's less than half of what the daily value is here. And these researchers are actually recommending less than that, or that at the very most, 400 to 600 milligrams of calcium a day. And they also emphasize adequate magnesium, because again, there's that ratio of calcium and magnesium. And they recommend that that ratio should be 2 to 2.5. So in other words, we should be consuming about twice as much calcium as magnesium, maybe 2.5 times at the most, 2.5 times as much calcium than magnesium. Let's look at the daily values in this country and see how that compares. First, let's look at it in 2016 and prior to that, before they raised the daily value to 1,300. So when the daily value of calcium was 1,000, magnesium was 400. That's a ratio of 2.5. Literally at the very high end point of that range. It's in the range technically, but at the very high end point. And then in 2016, they go and raise the daily value of calcium 30% to 1,300. They also raise magnesium daily value, but just 5%. So now the ratio is 3.1. So why are we being told to consume so much calcium? We don't hear so much about magnesium. We hear all this talk about calcium. You know, let's face it. If we're being told to consume loads of calcium, the implication there is to consume lots of dairy. Even though lots of vegetables and grains and stuff, we get plenty of calcium from other foods. But we're told that we have to have this super source of calcium in order to meet these extremely high demands of calcium. And that super source is going to be dairy. And how does that fit in here? Well, the dairy industry puts millions of dollars every year into lobbying the policymakers, into raising those daily values, into raising those recommendations, into making teaching kids to consume more calcium a part of the health education agenda in our schools, into making milk part of the school lunch, a staple to the school lunch program. They even have the lawmakers convinced to spend tens of millions of dollars every year to buy dairy products that consumers don't buy. Dairy products that are going to get thrown away. And that's all under the premise that these super high intakes of calcium are so vital to our health. And dairy is so crucial to meeting those super high demands of calcium that we can't take a chance of getting caught short on dairy. So, and the only way to really make sure we're not going to get caught short on dairy is to have a surplus of dairy. And who's going to pay for that surplus? Well, basically the taxpayers pay for that surplus. Tens of millions of dollars a year. And you would think the lawmakers would say, well, okay, let me see here. That makes sense, but let me just fact check you before we put all this money into this, before we start raising the recommendations and telling our kids to consume crazy amounts of calcium. Let's just look at the facts here. Look at this. Well, wait a minute. Actually, you know what? The science is telling me the exact opposite of what you're telling me. No, the legislators aren't doing that, because the legislators are in office because of the dairy industry. The dairy industry put the legislators in office. This is how much money the dairy industry is putting into the campaigns of people trying to get into office. This is just U.S. Congress here. This is the election cycle, 2015-2016 election cycle. $1.5 million went toward Republicans running for House of Representatives. Almost $400,000 went toward Democrats. That's about $2 million right there just to the House of Representatives that one year. And for Senate, about $800,000. These legislators, they're in office because of the dairy industry. They owe the dairy industry, and they know in a few years they're going to have to run again, and they're going to need that money all over again. Of course they're going to do what the dairy industry tells them to do. But do we have to believe them? Who do you want to believe? The dairy industry, who are lining their pockets on the concept that we need huge, unnaturally huge intakes of calcium? Or the scientists that are saying, no, those huge amounts of calcium aren't helping at all, in fact they're actually harmful? Are we going to believe that the dairy industry that's telling us the best way to deal with a leak in our tire is to overinflate our tire and try to keep pumping air into our tire? Or the scientists that are going to tell us how to fix the flat, or even better yet, not have a flat in the first place? And that's what the second part of the presentation is going to be on. So I hope you listen to that one too, watch that one too. That's coming up. Please share this with all your friends, share with your doctors, subscribe maybe. This is important stuff. It really needs to get out there. Thank you so much for watching.